The ability to exchange complex information between two or more human species is an extraordinary skill, and our brain is the organ responsible for this ability. Language is considered the most elaborate cognitive behavior, but sometimes something can go wrong and impair or decrease in your performance of speaking, understand spoken, or even impair written communication can happen. In other words, a language disorder can develop. Hi, my name is Tany, and I'm a student of the last year of the Bachelor of Medical Science, and in this short video, I'm going to talk about the neuroscience of language disorder. The first authors to investigate and report language disorders were the Frenchman Paul Broca and the German Carl Wernicke, where they described their understanding of aphasia. Aphasia is an acquired communication disorder that is caused by brain injury, most commonly stroke. It affects function of language such as speaking, reading, writing, and understanding spoken language. But importantly, aphasia does not impact a person's intelligence, as they are able to make decisions and participate in activities that does not necessarily involve communication. Language disorders are disabling, impact the quality of life, and cause distress to patients, caregivers, and relatives. In neurological practice, despite the language disorders being common and all scientific discovery in this field, the acute diagnosis and clinical evaluations can be challenged. In Australia, the prevalence rate of aphasia is 1 in 240 persons. This is an average of 0.37% of Australian population, or about 95,000 people. The statistic shows that 15% of individuals that experience aphasia are at age under 65, and 43% of individuals age 85 or older. So it's more common in elderly people. There is no significant difference found in the incidence of aphasia in men and women, but it may exist significant differences between the type and severity of aphasia. Another reference showed that up to 38% of stroke survivors in Australia can have aphasia as a sequela. Language skills require the input of information coming mainly from hearing and visions, which they are sensory information that are processed in various centers in the cerebral cortex, and we also use motor coordination output for vocalisation and writing. Those centers for language are found in the left hemisphere of the brain, typically in most people. Disorders in these centers usually are caused from injuries or lesions in the left side of the brain, for example due to trauma, strokes, tumors, or disease, or from forms of selective neuronal degeneration. Have attributed that the integration of spoken language in the human brain involves information processed in two areas called Wernicke areas and Broca area. Sensory input from either cortex goes first to Wernicke area, then to Broca areas. After integration process, output from Broca areas to the motor cortex initiated by spoken written actions. When damages occurs in one or more than one of the language centers of the brain, the person is diagnosed with language disorders. That's it, the person acquires aphasia from brain damage. Aphasia has multiple manifestations. Briefly, I'm going to cite a few. Damage to Wernicke area causes receptive aphasia, where the patients may have difficulty to understand spoken visual language. The speech may be affected, as the person has issues to retrieving words. If the damage is in Broca area, expressive aphasia may occur, and the person can understand and formulate simple spoken written language, however with no logical sentence. Global aphasia is the most severe type of aphasia. It's often seen right after someone has a stroke. Because language is considered the most elaborate cognitive behavior, as I mentioned before, the neuroscientists are dedicating considerable attention to this area of study. Researchers have shown that external stimulus to some other regions of the brain that are not specialized in language can be helpful for the recovery of language. These discoveries led to the development of transcranial magnetic stimulation treatment that enhances learning of novel vocabulary in a study in healthy participants. Hence, this therapy can be used for stroke patients with aphasia. Advances in neuroimages have been applied to address language disorders. MAG is currently used to study the human brain, including diagnosis of language disorders. Another imaging approach, Explorers, as the name suggests, is an imaging database used to predict language outcomes and recovery after stroke. And advanced MRI scans can provide quality images of the brain, which are improving the capacity for better therapies. It's important to mention that speech therapists are crucially professionals in the recovery and treatment of patients with language disorders. Therefore, to conclude this presentation, I would say that our physical ability to process language information and to vocalize the sounds is a complex system of your brain. Language disorders are common in neurological practice, but their acute descriptions can be challenged. So we need a lot of development in this area, such as improvements in their practitioners' skills in clinical assessment, training of speech therapists, more evidence-based research in the field, and development of therapeutic interventions guidelines so that in the future we can provide full recovery for patients. I hope you have enjoyed this presentation and learned a bit more about neurological language disorders. Thanks for watching.
Created using Powtoon.